Good morning or good afternoon, everyone. My name is Zachary Bernard, and I'm here to present the evaluation for the Delaware Health Science Alliance Champions Program. This project, in collaboration with Delaware Breast Cancer Coalition and Delaware State University, focused on strengthening community engaged research. Alongside Dr. Dorothy Dillard, we've gathered important information and feedback to understand how we can improve access to breast cancer screening and overall health care within the Haitian Creole community. Now let's dive in. The slide outlines the key components of the Champions Project. It was a part of the Delaware Health Science Alliance competition. Aiming to strengthen community engaged research, the project focused on creating research practice partnerships, fostering connections between scientists and the community. The process included two component research conversations and companion evaluation. These elements allowed us to engage both researchers and community members in meaningful dialogues that shape the research and its outcomes. On this slide, we focus on the research presentation aspect of the Champions Project. Researchers had the opportunity to present their work to the community in a clear and accessible way. This was part of the Research Conversation Initiative, where researchers shared their bios, research agendas, and career paths that led them to their current studies. These sessions were not just about showcasing their findings, but also about actively listening to the community's perspective and feedback, creating a collaborative learning environment. On this slide, we see the core structure of the research conversations. These sessions allowed researchers to present their work in a way that was accessible and understandable to the community. Presenters focused on explaining their bios, research agendas, and the career paths. Additionally, the community had the chance to learn about the researchers' interest in the project and their work might benefit the participants. This format helped make complex research more relatable and fostered meaningful interactions between the researchers and community members. This slide provides examples of the common language bios shared by researchers during the Champion research conversations. Each bio is written in accessible language, helping community members better understand the researcher's background and the goals of their work. For instance, Dr. Erin Perchiniak bio highlights her research on the P53 gen and how differences in this gen can affect cancer treatments. Similarly, Dr. Carl Melendi Gonzalez discussed his research on the environmental factors influencing triple negative breast cancer. These bios were designed to make the researchers' work relatable and encourage meaningful discussions between the researchers and the community. This slide presents feedback from both researchers and participants. Researchers emphasize the value of hearing directly from the champions about their needs and their interests. One researcher shared that the biggest benefit was learning how to better engage with the community and to adjust their presentation to be more inclusive. Another takeaway was the realization that PowerPoint presentations and other materials should be tailored to the audience's level of understanding. On the participant side, the feedback was equally positive. Many reported that these discussions enhanced their knowledge and motivated them to continue sharing information within their communities. One participant even mentioned that the information received was invaluable. It far surpassed any financial compensation, emphasizing the deep impact of these educational exchanges. Now, I would like to introduce the evaluation of the Delaware Breast Cancer Coalition Companions Project, which is essential to understanding the impact and effectiveness of the initiative. The evaluation was conducted to measure both quantitative and qualitative outcomes, providing a comprehensive picture of the program's success in increasing awareness and participation in mammogram screenings amongst Haitian Creole women in Sussex County. The findings from the evaluation helped to inform future steps for the program. The slide provides an overview of the Champions evaluation. The purpose of the evaluation was to increase the impact of the program in increasing breast cancer awareness and participation in screenings. The evaluation was broken down into two major components: quantitative and qualitative analysis. For the quantitative aspects, we focused on methodologies such as surveys, data collection, and examining sample populations and questions regarding screening rates, insurance status, and demographics. The qualitative components involved interviews and personal feedback from the participants to gain deeper insight into their experience and challenges faced during the program. Here we can see the quantitative data from the evaluation. The total sample included 85 participants, all of whom were women. The age range of participants spanned from 27 to 81 years, with an average age of 57. A significant portion of the participants, 41.89%, came from Seaford, which was the primary area of focus for this program. In terms of health metrics, we found that 69% of participants had not had a mammogram in the past year prior to joining the program. As healthcare insurance, 44% of participants were uninsured and 55 had insurance. After joining the program, 50.59% of participants reported had at least one mammogram screening, indicating that the program had a positive impact on screening rates. This slide provides further breakdown of the participants by city, medical insurance type. As shown, the majority of participants were from Seaford, which was represented as 41.89% of the total sample. Other cities like Milford, Salisbury, and Laurel also had contributed a significant number of participants, though they were in smaller portions. Regarding medical insurance, 37 participants were insured, while 32 had private insurance and 13 were covered by Medicare. This data highlights the diversity of insurance coverage amongst the participants, which is a key factor in understanding their access to healthcare services, including mammograms. Here we see the correlation between insurance type and screening status. Women with private insurance were significantly more likely to be up to date with their screenings, with 79% reporting that they had received a mammogram. In comparison, only 36% of women without insurance were up to date with their screening. This highlights a critical role that insurance coverage plays in accessing preventative healthcare services and suggests that increasing insurance access could improve screening rates. On this side, we break down the number of women up to date with their screening by city. Women from Sussex County, particularly Seaford, had the highest number of up-to-date screenings, with 23 out of 37 participants being current in their screenings. This suggests higher engagement in screenings within this county. However, we also see small numbers of participants from other counties like Caroline, Kent, and Wicomico. These lower numbers indicated a need for further outreach and engagement in these areas to expand participation and improve screening rates. This slide highlights the findings related to the age groups and screening status. The 60 to 69 age group had the highest percentage of women up to date with their screenings, with 77%. This slide shows the importance of referral dates and focus and follow-up presence in the program's success. We found that women referred in recent years, 2022 and 2023, had higher up-to-date screening rates, which suggests that the program's growing effectiveness and increased engagement are positively impacting screening outcomes. Additionally, women with follow-up records had higher rates of being up to date with their screenings. Specifically, 27 out of 42 women with follow-up records were current with their mammograms. This suggests that consistent follow-up efforts play a critical role in maintaining engagement and ensuring that women stay up to date with their screenings. This slide represents the 4 key categories of the qualitative findings, which is the impactful moments, biggest barriers, successful factors, and a conclusion. Several participants shared touching and powerful experiences, particularly regarding the loss of loved ones to breast cancer and how these stories shaped their engagement with the program. We identified key barriers such as fear, financial constraints, and logistical challenges, especially around transportation. The program's success was largely driven by education, community involvement, and the support services offered, such as transportation, which made it easier for the women to access. And to finalize everything, the conclusion, which gathers all the information together. This slide highlights several impactful moments shared by participants in the program. Emily encountered the heartbreaking story of two women from her church who were affected by breast cancer. One woman ignored symptoms and was afraid to seek medical help, which ultimately led to her passing. The second woman, very close to Emily, chose to rely on faith and natural treatments rather than medical intervention, which also resulted in her death. This story underscores the critical need for early detection and proper medical care. Olivia shared how the educational component of the program had a significant impact on her. She now feels more aware of her body and is open to discussing any symptoms with her primary care provider. And reflected on learning about the different types of breast cancer and how treatment options and surgical procedures vary depending on the cancer type and its aggression level. This was a moment of empowerment as Anne felt better equipped to make informed decisions regarding her health. This slide outlines the biggest barriers faced by women in accessing mammogram screenings. Many women fear the anticipation of receiving results, especially the possibility of a bad diagnosis. The fear of the unknown and the potential of life-threatening conditions discourages them from getting screened. The biggest barrier to accessing mammograms for Haitian Creole women in the Sussex County is the fear of being billed for services and acquiring medical debt due to the lack of insurance. Transportation is another significant issue, as many women either don't drive or don't have someone to depend on to get them to screenings. A major barrier is the lack of awareness as well about the importance of mammogram screenings. One Chanpyon participant shared that she often encountered women who are scared to have mammograms due to the fear of misinformation. Now we'll talk about the key success factors that contribute to the effectiveness of the Chanpyons program. The first one is training and education. One of the significant success factors was the education provided by the community members. For example, Emily mentioned how the training she received gave her the confidence and actively promote breast cancer awareness in her community. The Breast Cancer Coalition played a critical role by offering transportation support and ensuring that women could access screenings. Without this help, many women would not have been able to participate in the program. Community involvement. The program's enhanced emphasis on community involvement was another key factor. By having community advocates who educated others about the importance of screening, the program helped bridge the gap, creating a cultural and language barriers. The patience of the dedication of the Chanpyon staff were also critical. One participant mentioned how Margaret would arrive early to pick up participants, providing them with the personal support they needed to engage in the program. To summarize the key findings and the conclusion for the Chanpyons program, there was a significant increase in screening rates from 22.35 to 50.59%. The program successfully addressed cultural barriers and misconceptions by offering tailored interventions. The role of credible messengers like community members who could relate to the participants was critical in overcoming both logistical and emotional barriers. The Chanpyons program culturally sensitive approach was effective in increasing mammogram screenings amongst Haitian Creole women. This model can be adapted and applied to other underserviced populations, demonstrating the potential for broader impact. In summary, the Chanpyon program was successful in significantly increasing mammogram screening rates amongst Haitian Creole women. The integration of culturally tailored outreach and the use of credible messengers were key factors in overcoming both logistical and emotional barriers that many women face when seeking screenings. The implication of this success highlights the importance of culturally sensitive health interventions and addressing health disparities. This model can serve as a blueprint for similar initiatives targeted other underserviced populations, making healthcare access more equitable. Thank you for your attention throughout this presentation. If you have any questions or would like to discuss the evaluation further, please feel free to reach out to me or Dr. Dorothy Dillard using the contact information provided here. We appreciate your time and interest into the Chanpyons program and look forward to any further discussions. Thank you to the Delaware Breast Cancer Coalition, and thank you to the Delaware Health Science Alliance. Thank you for your attention, and have a good day.